Welcome back. We're going to be talking about lymphedema in this audio lecture. Okay. So lymphedema is going to be accumulation of lymphatic fluid. Remember that the lymphatic system is responsible for returning fluid that is filtered during capillary exchange back to the cardiovascular system. Right? So the lymph actually takes away all not all, but a lot of the interstitial fluid, right? So it's going to make sure that, because during capillary exchange, reabsorption of interstitial fluid only occurs to such an extent. It only reabsorbs about 85%, so leaving about 15% in the interstitial fluid. Now, this can result in lymphatic buildup. Okay, so the lymphatic system is responsible for taking it away, but if we see that something is wrong with the flow path of this lymphatic fluid, we start to see it build up and accumulate in the periphery. So we oftentimes see lymphedema in the arms and legs. I've really only seen pictures from the legs, but I suppose it's common in the arms as well. We have primary causes and secondary causes of lymphedema. A primary cause would be a disruption in the lymphatic system alone, right? So we might have stenosis of lymphatic system. We have a slow-moving fluid, so this gets returned right above the venous circulation, returning to the heart. And so we might have a congenital disorder where we get lymphatic malformation. Okay. A secondary cause can be something damage that is caused by something else, and this is going to be generally caused by surgery. So maybe they have blocked or cut cauterized a lymphatic vessel. Radiation damage. So if we cause those cells to mutate in the DNA, cancer can block lymphatic flow, right? So the cancer impedes on other organs, and so this would be an effect of systemic response. Or infection, right? So this is really what I'm familiar with, but a microfilarial infection that causes a condition like this, where you get this massive accumulation, and really it's a parasite that lives in the lymphatic system, and so it's getting plenty of nutrients there, and so it just sets up shop there. Well, the parasite buildup blocks lymphatic flow back to the heart. Okay? And so this is an image of, this is a condition called elephantitis, okay? And this is from a parasite that is transmitted by insects, okay? And it blocks the lymphatic flow, and it leads to buildup of fluid. Okay. How does lymphedema manifest? It begins with edema, and edema is fluid accumulation, really in the interstitial fluid. This is in lymphatic fluid, but it could also be in the interstitial fluid as well. Hence how we have these big pockets here, because anytime you have pressure building up, it's going to affect things behind it. Okay. Similar to varicose veins, if you get abnormal blood flow, we get hyperpigmentation, in which you could get discoloration of the skin, maybe a brown color. Ulceration is going to be due to the decreased blood flow caused by lymphatic buildup, and this is increasing the venous pressure, decreasing capillary exchange. Okay, so wounds cannot heal as well, and actually some wounds end up going necrotic and ulcerating. Okay. Here we have this new term, and this term is called brawny edema. So brawny edema is going to be, so edema is generally, if you get injured your ankle, you can push down on the skin and leaves a pit, and that's called pitting edema, right? And here we have brawny edema, and so it's called non-pitting edema, meaning that if you were to push on it, it doesn't indent, it doesn't leave a pit where you push. So how is it diagnosed? Physical, medical history. Maybe you've been on a recent trip to a subtropical area or tropical area, resulting in this buildup of fluid. Right? That's going to be one big indication. Is they're going to ask, well, have you been out of the country recently? And maybe you have. Okay? Imaging techniques like MRI or CAT scans would help you identify this, and then Doppler ultrasound would allow you to listen to the blood flow And really, this Doppler ultrasound is probably not going to do too much good here. But we could use it to kind of trace back to see if that is actually the issue. Now, how is it treated? Well, first and foremost, compression devices. So compression socks would be a nice use. So we are trying to increase the pressure of our interstitial fluid to promote the delivery back to the heart. Exercise will help mobilize this fluid as well. Massage therapy, anything that's going to help mobilize the fluid, okay, that can build up in your lower limbs. Okay. Antibiotics, antiviral medication, anti-parasitic medication is all going to be used in an effort to get rid of the infection that is causing this buildup of fluid. Benzopyrone agents. Benzopyrones are able to bind to interstitial proteins, inducing a macrophage and proteolysis. And so this is going to be an effort to activate the immune system to go in there and kind of break down anything that's causing this disorder. We could use diuretics, so anything to promote the water removal from the body. Okay, so that's going to be decreasing the blood volume, and then the blood pressure is going to go down, so you get the decrease in filtration. Okay. So all these are in an effort to get rid of the fluid accumulation here. And then after that, we're going to try to remove the excess skin. So the skin is stretched quite a bit. Here we see a post-surgery or pre-surgery. Here's post-surgery over here. And we notice that a lot of the skin is removed. And then, but there's still some stretching left over. So with that said, that is the end of the lymphedema lecture. Until next time.